I worked as a paramedic for 10 years. I saw lots of things going into people's houses that were contributing to poor health. And so I started thinking, I really want to work on that stuff, the stuff that we're not really talking about with patients, and figure out giving them back the tools they need to take care of themselves and improve their health. So I decided to go back to graduate school in clinical health psychology and specialize in that, in what we can do to help patients. These disorders can be stressful in and of themselves. There's lots of things that come along with it besides the pain. There's lots of other things that come along with having a gastrointestinal disorder that lend itself to stress. So it's kind of like the cycle that we see where the symptoms show up, people get stressed, symptoms keep going up, it makes more stress. But we can do things in there to intervene in that. So the patients we see here, a lot of them have been trying to cope with this disease and manage any of their gastrointestinal symptoms for quite a while. And usually they get here as like a second or third opinion. We see a lot of not only inflammatory bowel disease, which is what the physicians I work with specialize in, but also a lot of irritable bowel syndrome and functional gastrointestinal disorders. Once they get in, the physician sees them, then I see them to see what else we can be doing in the background to help these patients. So looking at, like I said, stress, anxiety, depression, working on the brain-gut connection, and helping them cope with the disease in general. So really trying to make sure that we see this person as a whole person. We also have a dietitian that works because we know that all of these pieces together really come together to make the patient better.